But first, with yet another new record number of corona cases in Victoria today and 6 more deaths, 5 of them in nursing homes, on top of the 10 deaths yesterday and 7 of those in nursing homes, you've got to ask yourself, what has the Victorian government actually been doing for the past few months? From the very beginning of this pandemic, it's been obvious that elderly people are the most vulnerable, and equally obvious that nursing homes have been the places most exposed to danger. You'd think, wouldn't you, after the Newmarch House fiasco in New South Wales in April, where 16 residents died, that any half-decent Victorian health minister would have checked and double-checked protocols to ensure that all nursing homes had infection control measures in place for staff and residents, that they had adequate supplies of PPE, and that all of them had a plan for what to do if staff or patients became infected with coronavirus. If having staff working at several different nursing homes was such a problem, why has this only been thought of now? And you'd think, wouldn't you, that basic issues such as whether nursing home patients with coronavirus would be treated at the nursing home or transferred to hospital, well, that would have all been considered and clear guidelines issued. But as we're only finding out now, of course, not much of this has even been done. I don't think I've ever seen government mismanagement on such an epic scale as we're seeing in Victoria. It's one thing after another. It's one excuse after another. All the Premier could offer today in one of his increasingly lugubrious press conferences was the weak excuse that it was somehow the federal government's fault. All because the federal government fund and regulate nursing homes, even though Newmarch aside, no other state has had the same aged care crises on its hand as he does. Now, I accept that in any disease outbreak, nursing home patients are likely to be at risk, that under living will arrangements, many nursing home patients don't want heroic interventions if they become sick. But if every hospital system is supposedly ready and ramped up to deal with corona patients, the number of ventilated beds in Victoria have supposedly tripled to deal with that pandemic, just letting older Australians die in nursing homes, to not even try and save their lives, if that's what they want, if they want to be saved, and then to shut families out and withhold information, if that's what we are in a first world country like Australia, we all should be ashamed. Now, I accept that communication with relatives has to be a matter for the staff and management in each nursing home, but when families are routinely being kept in the dark, it looks like a failure of government. It's bad enough not to know that your parent or grandparent is sick. What about not even being able to visit them as they're dying? Surely there's got to be a way we can manage risk and infection and still allow immediate family to be with their loved ones in their last hours. After all, notwithstanding an earlier tragedy, old age will come to all of us, and but for the grace of God, there go I. These nursing home residents have paid taxes all their lives. Surely they deserve care from a medical system that doesn't hold back an intensive care bed just because they're 80 or 70 or even 65. At what age does the health bean counters determine old lives matter and other old lives do not? What riles me most about the epic incompetence of the Victorian government is its sheer inhumanity. At every point in this crisis, they've stuffed it up monumentally. And yes, there's now a new Victorian Aged Care Response Centre, so they call it. But is anyone from all of the various different agencies sitting around the table actually in charge? If it's not the Premier, if it's not the Federal Minister, or even the State Minister, who is it? Who's in charge? This is just another title change. Because as long as everyone's in charge, let me tell you, no one actually is. And in Victoria, that's been the problem all the way along.